Good afternoon, everyone. Welcome to this afternoon's Health Department briefing. Wanted to let everybody know that we did submit a new Heart of Illinois implementation plan to the governor on Friday for his consideration. We haven't heard anything back from him yet. We're hoping that we will hear something today or tomorrow. There's a decent chance that we will roll out or at least explain publicly the plan that we put before the governor tomorrow afternoon. I wanted to say a special thanks to all the work that's been done throughout this by our regional superintendent, Beth, and also Peoria Public School Superintendent Sharon, Desmoulin-Kherat, and other administrators and teachers. I think a lot of folks have really gotten a new feeling for all that it takes to prepare for classes and all the work involved in helping give our children a good, solid education. And I'm glad that they're both going to be here to say a few words today. At this time, I'd like to introduce Monica Hendrickson from the Health Department. Monica.
Thank you, Mayor Ardis. Begin today's briefing with the to-date totals for the Tri-County region. The Tri-County of Peoria, Tazewell, and Woodford sit at 214 cases to date. That's 142 for Peoria, 57 for Tazewell, and 15 for Woodford County. There are no new deaths to report. Currently, 66% of the Tri-County cases are considered recovered. 23% are at home and isolating, and 6% are currently hospitalized. In regards to the hospital data, OSF, St. Francis Medical Center, Unitypoint Health Methodist, Proctor, and Pekin report that currently 12 ICU beds are in use, of which 3 for persons under investigation and 9 for confirmed cases. There are 39 non-ICU beds in use, and there are no deaths to report in the hospital system in the past 24 hours related to COVID. Heartland Health Services saw 291 tests conducted over the weekend here at the Peoria City County Health Department, and today they've done over 200 tests at the East Bluff site. In regards to our area, I think there's a lot of questions about how we always compare to what they're now posting in terms of Restore Illinois. And I can say that in terms of our case count, our 14 and 7-day averages remain stable. We don't see any necessarily growth nor any decline, but really kind of the stable sitting about an average 7-day and 14-day average about 7 cases is what we are at right now. I think I also want to just acknowledge what Mayor Ardis said in terms of our educational component during this pandemic. Lots of schools are now transitioning to the end of school time period. And to really kind of give feedback of what does that mean, to begin with, I'd like to welcome Dr. Desmoulin-Kherat, Superintendent for Peoria Public School District.
Mayor Ardis, Dr. Monica Hendrickson, I want to thank you for allowing Peoria Public Schools to provide an update. We're actually accomplishing quite a lot. Everyone in the school system is truly committed to this new experiment. I would also like to extend my gratitude to all of the essential workers who have been working on the front lines for the past 2 months to provide those essential services to us. I would just like to tell them to continue to protect themselves and others. COVID-19 has produced what many of us would say is the largest worldwide and systemic disturbances of all time. While schools were closed overnight and our daily routines have changed, the inequities produced by our systems are even more stark in terms of which students have access to technology, internet, food, and housing, and which families have the privilege of sheltering in place to stay safe. And so with that in mind, Peoria Public Schools, we have used 4 priorities to guide our work during this pandemic crisis. Priority 1 is feed our children. Priority 2, account for the extended safety, health, and welfare of our over 15,721 students and staff. Priority 3 is to communicate very, very clearly and regularly. And priority 4, provide continuity of learning for our students. So under priority 1, one of our first steps as an organization that we took back in mid-March was to quickly put a plan in place to continue feeding our children, because many of them rely on the meals served during a normal school day. With the help of Sodexo, our school provider, and Major Heath Sells at the Salvation Army, and a committee of Peoria Public School staff, Regional Office of Education staff, and over 100 volunteers, 19 food distribution sites were set up at locations across the city. And in addition to those sites, the Salvation Army continues to deliver meals to neighborhoods such as Harrison, Holmes, Taft, and River West, with high concentration of Peoria Public School students. To date, over 215,000 meals have been served to Peoria students and families since March 17th. This is a staggering figure and truly the product of tremendous collaboration. Our plan is to continue to serve meals until June 30th, and hopefully after that, I'm awaiting approval, so stay tuned. Under priority 2, to focus on the extended health and well-being of our students and staff during the governor's shelter-in-place order, we were intentional about identifying the needs, everybody's needs, and providing support, ensuring that everybody gets support. And so as a district, what we did is we created a team called PPS Matters Team, and it's made up of teachers and social workers and counselors, and we receive emails, inspirational messages. Everybody in the district receives that. Also simple exercise regimens and mindfulness practices to cope with some of the stresses the pandemic brought on to our normal life. And actually today's message was, look how far you've come. Now, how far can you go? And I really like that message, and I would like to say, let's not give up. I know it's very, very hard, but let's not give up. We're very close. In addition to these wellness checks, with phone calls and home visits are also being made, many of our staff, our support staff, they're delivering meals, they're delivering computers to homes, and they're also delivering homework packets to families, those who are interested in the packets and not the online work. Our community partners also have been a very, very huge support. For example, Elite Organization, they're in 3 of our school buildings. They have over 3,000 contacts with our families. Family Core, they're in 15 of our school buildings, 15. They have served over 7,000 contacts with our families. Children's Home, they're in 8 of our buildings. They continue to provide therapeutic support for over 120 students during the shelter-in-place order. The Wraparound Center has continued to take referrals for our families and community members who are struggling to meet basic needs. And of course, the food pantry at the Wraparound Center, they continue to distribute about 100 food packets every Thursday. We've also reopened our Unitypoint Health Clinic, which is located at the Manual Center, Manual Academy, Manual High School, to provide health services to our families, including immunizations and physicals for the next school year. And that number is 495-8509, 495-8509. Under priority 3, from the onset of this pandemic, I did not want our families to be in the dark at any point about the new direction we were heading regarding the remote learning. And even before school buildings had to be closed, we were communicating regularly with our families about COVID-19 starting way back in early February. We sent out daily messages to all of our stakeholders in the week following the governor's school closure decision, and in total, I've sent out 15 updates to them keeping them updated regarding the information, the procedures, and also providing words of encouragement. Also, our principals are doing a very nice job with regular calls and emails to their families. These updates will continue into the summer as we confront the uncertainty of returning to school in August. And as a result of that, I have formed a return to school committee made up of about a dozen stakeholders, including actually Dr. Monica Hendrickson, Beth from ROE, and union leaders, parents, and so forth. The committee's goal is to put forth a plan or a series of plans for next school year, and we're hoping to have that finalized on or before June 30th. So again, stay tuned for more information in the future. And then priority 4, our motto from the very, very beginning of this process has been, buildings are closed, but learning continues. And to the immense credit of everyone involved in Peoria Public Schools, we have done just that. And one of our most pressing opportunity involved ensuring all students all had access to devices that supported remote learning. And as a result, we've delivered over 6,000 computers to families since remote learning started. And we've worked very, very closely with Comcast to ensure that our families have access and had access to affordable internet connections to support that learning. This past week, the 5th week of remote learning, we saw engagement numbers which are much higher than the national numbers. 75% of our high school students are engaged, 79% of our middle school students are engaged, and 70% of our primary schools are engaged. So I want to thank, with my most sincere gratitude, our parents and our families for their flexibility and their understanding in what's been an unparalleled situation in education these last 2 months. I also, as the mayor mentioned, want to commend our teachers and the larger Peoria Public School staff for rising to meet this moment and challenge, and as we continue to serve our children. I am super excited about graduation. I'm super sad about the fact that we will not be able to conduct our traditional graduation, but I'm excited to host the virtual graduation ceremonies for our 3 high schools this Saturday. More than 700 seniors in the class of 2020 will graduate from our high schools this weekend. The ceremony starts on Saturday, and they're as follows. Peoria High will be at noon, Manual will be at 2, and Richwoods will be at 4. And these virtual ceremonies can be viewed publicly on our district YouTube logo. Also, it can be viewed on Facebook Live on channels 22 and 20. Families and graduates will also receive a secure link to Zoom Enterprise viewing platform. So graduates also can pick up their diplomas from each school once the ceremonies conclude. And just a few more items as I close. We have officially begun the registration process for incoming kindergarten students for next year. So to families, please call your school to begin this process, the child's school, the school the child will be attending. We are honored to welcome you to our Peoria Public Schools families. Then parents, please refer to the plans being communicated by your principals to pick up the personal items. As we look at wrapping up and closing up of school, there is a process for picking up items the week of May 18th. So work with your principals. They'll provide guidelines regarding that. And then just quickly, summer school, a lot of questions around summer school, what's going to happen with that. 17 schools will be hosting summer school, but it will be remote summer school. Also, Knoxville will be hosting the credit recovery option for all high school students. And the goal is to provide ongoing support for our students to avoid additional learning loss or learning regression as a result of the COVID experience. So please visit our the school's website. Every school website, you'll get information regarding various dates and registration information. And students who are attending summer school, they do not have to turn in their devices. Hold on to those devices. They'll need it for the remote summer school learning experiences. And as I close, I would like to say on behalf of Peoria Public Schools Board of Education and the entire Peoria Public Schools family, we thank you for your ongoing support and understanding. At this point, our Regional Superintendent of Education will be next. Thank you. Beth?
Hi, everyone. Beth Crider, Regional Superintendent for Peoria County. And can I just say thank you to Dr. Kherat. She is one of the best in our region, and she has done a tremendous job leading during this very difficult time. It's not an easy task, so thank you for everything that you are doing. I'm here to address the million-dollar question. What are we going to do in the fall? So the superintendents in Peoria County have been meeting on a regular basis. We meet 3 times a week or so on a Zoom call to ever since the shelter-in-place order was given. We're working very hard to share resources, develop plans, share ideas. What are the options out there? And at this time, there is absolutely no fixed plan to bring us all back to a school building in the fall like we all want. So we'll be meeting to potentially work through 3 scenarios. The first one is very simple. What if we're still to shelter in place and we can't gather? This will trigger the need to continue to utilize remote learning as we've been doing. However, schools can take the plans that they already made this year, tweak with all the lessons we have learned by the implementation this spring, and improve the plan for when we come back in the fall. Second, what if we need to utilize social distancing? This will also trigger a response by how we change the way we deliver school in the school building. There are different ways that we can mitigate the spread, and it's not just trying to keep children apart, which is a side note. As a 17-year teacher of kindergarten, social distancing in kindergarten is touching one another, so we would have to work through a lot of things around social distancing. But we will be working together and listing all the tools needed in our schools to keep everyone safe. And lastly, can we go back to school, resume all activity as outlined in Phase 5 of the governor's plan? This option, believe it or not, also needs a quality plan. Children have been out of a school building and remote learning by that time for almost 6 months. We need to be able to reacclimate back to in-person learning, and that's not just for the children, that's also for the educators. And what do we need to do for the families that must quarantine or families that are fearful of returning? What options do we want or do we need to provide during that time? So as you can see, there's a lot of unanswered questions. The best we can do in Peoria County is to plan for all of those scenarios so that we're ready and we have the tools we need to implement school in the fall, no matter what that looks like. Now, I would like to say that as a mother that has worked out of the home for all of my career, I am keenly aware of the need to address childcare and the need of this that school fulfills. We will do our best to get information out to parents as quickly as we possibly can, but we will also be relying on the Illinois State Board of Education's guidance or further proclamations from the governor's office to help us determine what those next steps are. Now for the question and answers, if you have one for me or if you have one for Dr. Kherat, I'll step to the side.
Well, since you're here first, I'll ask, so she shared, the numbers for PPS in terms of, people that are, gaining, from the 75% of high schoolers being involved. What are the numbers we're seeing on the county level?
Different schools are measuring engagement in different ways, but they're all tracking it from phone calls of connections between teachers to students, logins on those devices and the different platforms that the different schools are using, or packets that are being turned in. So engagement is looking different depending on the district that you go to. I'm very excited about the numbers that we're seeing, but there's some things that we may need to adjust. We did this very quickly and we implemented, and I think that we have plenty of time over the summer to adjust as needed.
So as you mentioned, obviously with kindergartners, social distancing, definitely difficult. So is there any, in some of the plans that's talked about, saying maybe bringing back high schoolers, but not necessarily elementary students?
I would like to say at this point, all options are on the table. Mitigation doesn't look just like standing 6 feet apart. What else can we do? What else can we do for ventilation, masks, all the things that we would need to do to keep kids safe? But we're gathering all that information now so that we have the summer to implement.
Dr. Kherat mentioned that there was going to be a return to school committee created by or before June 30th, and you talked about this plan as well for all scenarios. By when will this plan be finished? When will parents be able to know about this? Or they're probably thinking about it right now because the summer's going to go by really quick. So when will they expect this plan to be rolled out?
I wish I could give you an exact date. Peoria Public Schools is mobilized quickly. They have the biggest district in Peoria County to get ready for. So they have a committee that has got all different kinds of stakeholders as a part of it. Each district is doing that differently. We're just, as a regional office, trying to provide overall guidance so that each local superintendent and board and teachers have the information they need to make a good decision. I would love to tell you that that would be early this summer. But as we've learned with this virus over this time, is things change and they change quickly. So that's why we have to be prepared for multiple scenarios.
As far as when you're talking about this fall, ma'am, and you're bringing up all these different types of options and stuff, one of the things that has been floated, at least on the national level, is that you might have some kids go in the morning and some kids go in the evening. You have just said that all things are on the table, but at the same time though, there are parents who work, and there are people who, one school. If a kid is zoned for a certain school, and if they can't physically do what that school does, are you guys going to, is there talk of trying to allow kids to go to various places to make it work within their thing? Do you sort of get what I am saying?
I absolutely get what you are saying, and everything that we do is triggered by what we're allowed to do by law or by a waiver that has come through a proclamation. And so unless we had a waiver for school district boundaries, we wouldn't be able to do anything around moving children from one district to the other. However, with the options, those all come with trying to reduce the number of students in a building, which is an option under social distancing, but we have to weigh that with what is to the benefit to the all, and as I mentioned, childcare. So we will definitely, we're very aware of the consequences of any decision that we would make.
So I guess one question I have, looking kind of from a longer term perspective, so I know that schools in Peoria County and across Illinois and across the country had to adapt very quickly to this, roll out extended online learning plans, figure out food distribution plans. I mean, there's a lot of moving parts here that had to be solved very quickly. But as we look down the road here, I mean, is there a fear or a concern that there might be a lapse or a lag in, student learning just from being out of school for so long? And if there is, how do we catch up or make up for lost time, so to speak?
I have been gathering information. There are a plethora of webinars out there right now that you can watch if you want to, and articles about what I call the gap. There could be a gap in learning or in access, and so how do we assess that when we get the students back with us, back in the building? And we need to be able to get some good information around that so we can put some interventions in place. So if there is a gap, we need to know what it is, how big, and how we can address it.
As far as the
How do you go about assessing that? Is there going to be an exam or a test that you do for students when they come back to say, okay, here's generally where the class is, and that maybe we need to start back here instead of up here?
So one of the tools we already use as an example is NWEA. So we would use the tools we're already using. The parents, the teachers, and the students are already familiar with those tools. But it's looking at what the results are now and what that's telling us, and how to look at the results differently instead of bringing in something new. What do they already know, and what do we need to use? Plus, we also need to make sure we're giving that SAT to the juniors that missed it this spring. So we will definitely be utilizing that information in the spring as well.
Are you all at all worried that there may be low enrollment next year in Peoria County, simply because even if you all roll out a plan, even if you all tell the parents to trust you, they still might not with their child, and they still might be worried that something could happen, so they decide not to put their child in school. Are you all worried that there might be low enrollment come next school year?
I will address that with the superintendents that I've been working with through this experience have put children first in every single scenario that we've addressed, and I have been so impressed. Will families need to make individual decisions? Absolutely. If you're living with someone that is older, if you're taking care of grandparents, different families are going to have hard decisions. But as the school, I can tell you, we will do everything we can to make sure we are ready for your child, however that looks, in the fall, and their safety will be our primary concern.
One of the things that I would like to know, and I believe the superintendent brought it up too, is that you guys talked about the gap of learning. But schools do more than just teach, reading, writing. There's the social interaction, and you're dealing with a whole bunch of kids right now who are living on the web, who are living through Zoom, who are used to, or at least for the last few weeks, to going to school in their bed, maybe, or whatever. What are you, or what is D150 gonna do to try to get these kids ready to go back to being students again, and not just kids who lay in bed on their laptops?
I'll give a brief answer, then I'll let Dr. Kherat take over. Let me say this. I downloaded an article today about the social and emotional tasks in front of us when we all come back to school, and that we need to be deliberate and intentional for reacclimating everyone back into the school building. That we can't just open the door and say, welcome back everyone and let's do school. We have to be very, very intentional with the things we plan, the way we talk to children, and the activities that we do with them when they first come back to school. Because I do know school, there's so much more to school than just what happens in the classroom. My husband's the athletic director. The grief and the missing of sports and what that does for students and what they're missing with that. There's so much to it, but as we go through this planning, one thing reveals another thing, reveals another, and we are tracking all of that information. So I'll let Dr. Kherat address that as well, if she would like to.
As you heard previously, we're doing quite a bit for our kids. You heard about the over 6,000 devices that we sent home. You heard all of the engagements and the contacts as it relates to the social emotional. You heard about Family Corps and providing meals to families. You heard about feeding over 250,000 students. So when you look at what we're doing, I'm like, what else are you wanting us to do? I guess that's my question. But I'm really proud of what's happening. What kids are, we are monitoring their engagement. They're learning. They're getting online. They're working with teachers, and they're being fed. They're getting social emotional support. Is it perfect? It's not perfect. Is it? It's the next best thing for sure. And I would say I'm really proud of the effort. I'm super proud of the effort, and where we are right now, it's exceeded my expectation as a district, to be honest with you. So I guess that's how I'd respond to that, Andy.
All right, thanks.
You're welcome.
Dr. Kherat, similar to what was asked of Ms. Crider, in terms of the gap, this doesn't only impact the students of what they might not pick up, learning through this virtual setting, but teachers, because then, fast forward to next year, if they're supposed to learn, certain number of grammar tools the year before, they don't carry that on to the next year, it can impact then that teacher maybe having to reteach. So what kind of communication have you had with teachers about that potential problem?
Yeah, it's a big question for us, and it's something that I think about a lot around the learning loss. And obviously, despite what we're doing, I I would be first to say there is some. And there are lots of strategies and lots of options. We talked about loop-in, for example. The kids would, I love the idea. On Friday, I spoke with my team about that. The kids are staying with the same teachers that they had. That's one strategy because, remote is, I don't think remote learning is going anywhere. I mean, previously, I think Treasurer asked, what about some of the families who don't want to come back? And they should be given that option. I think parents should be given an option, and if they do want to continue remote, why not? This is, I think, although the pandemic to me, it's wicked and it's really bad, but we could use that as an opportunity to experiment. I call it an experiment, and definitely experiment. So, and remote learning, it's a lot around developing relationships, right? And so we have to learn how to do that remotely. And so if you have students who are already familiar with the teachers, then wow, we're a step ahead already. They're aware of where they are academically. So I really, really love that idea. Even if it's primary, let's say first through, because kindergarten, we heard about kindergarten. Kindergarten, it's a different grade. And it's tough doing it in kindergarten. So that's an idea. We have a lot of ideas that we're exploring for sure, but I love the loop-in idea, and it's a piece that we, Beth talked about providing interventions, providing actually tutors. There's an article that I read that I really, really liked around even getting tutors from Bradley University to be connected with certain kids who are struggling, because not everybody, right? So the ones that are really, really at need. So we can, the sky is the limit. As long as we're willing to be creative and we're willing and we're able, we can get it done.
Dr. Kherat, is there a plan to continue the food distribution during the summer months for students who might not have another way to access food?
Yeah, thank you for asking. The question has to do with continuing the distribution of the summer meals. That will end June 30th. And we're hoping that I would like us to continue serving meals to our students. We don't have the green light yet from the FDA, and so we're waiting on that. I don't anticipate a problem, so hopefully we'll get something via Illinois State Board of Education. But currently it's through June 30th, and hopefully we'll be given permission regarding reimbursements for the month of July and even into August, like we have traditionally done for many, many, many years.
And I know you mentioned that your priorities were one of them was accounting for the extended safety and health and welfare of students. Something we have been talking about is the child abuse rates or just abuse rates going up since social distancing, the shelter in place, and teachers are mandatory reporters for things like that. I just wanted to know, how did your staff go about making sure that these students were safe while at home?
Yeah, that's a very good question and a huge topic for superintendents, and actually our state superintendent. We receive weekly updates from her and always talking about that engagement. That's why the engagement is very important. And you've heard I mentioned that Family Corps, they are one of our subcontractors, and they're providing social emotional supports for our students. They've made 7,000 contacts, and so the idea is to contact and talk to kids and check and see how they're doing. We can't really see them, but you can get a sense. So I really appreciate that all of our support staff, they're actually doing home visits. And so you have Family Corps doing 7,000, you have Elite doing 3,000, you have Children Home, they're providing therapy and for about 120, and I have quite a bit of support staff going out. So I think we're trying, we're really intentional and strategic around it based on the circumstances. So, but I feel good about our strategy and how we're going about engaging and making contact with kids and checking up on them.
We're actually going to cut questions for Dr. Kherat here. Thank you very much.
You're welcome, thanks.
Is there any further questions for the health department?
Question, when you said 14.7 average, was that Peoria or the Tri-County?
So the 14-day and 7-day averages that are stable in terms of case growth, that is for the Tri-County region of Peoria, Tazewell, and Woodford.
Just a quick one, Monica. So the Bloomington testing site just announced that it's closing down on Thursday, and they're telling people that if you need testing and you live in the Bloomington area, you need to come to Peoria, basically. I mean, does Peoria have the capacity to handle that? I mean, what's that going to mean for us?
So the question is, with the McLean community-based testing site, that's federally test site, closing, there is conversations about bringing people over to the Peoria area for the test sites. And I think Sharon Adams addressed some of that last week in her briefing. But the capacity between the Heartland Health Services and what they've done in terms of moving the Carver site to Pekin, keeping the East Bluff and even the Peoria Health Department site on the weekends, they are within their capacity to do that. I mean, today they did close to 200, and that's because they have been able to get those resources from the state and other labs. And so I think with that push over here, from what I understand and having those discussions with Sharon as well as other leaders, we feel like that is a capacity that we can handle here locally.
Because going off of that, you know, I just was on their call this afternoon, and for example, on Friday, you know, they had like well into the 100s number of tests conducted. You know, I just kind of, how would that work out? How would we possibly put restrictions back on the testing? You know, now you have to have symptoms again. Is there any conversation about that?
Right now, in terms of when the increased capacity issues, are there concerns of us needing to prioritize testing? And as right now, no. I think what we're realizing is that we have the ability to do that testing, and the capacity between Heartland Health Services and their different clinics locations can easily maneuver people through there. And so, again, today, another stellar day from them to see 200 individuals for testing.
About how many tests now are we up to at all of the sites? Are we going 2, and then we're hitting 600 each day, or what?
So the question is how many tests we're doing on average daily. Well, starting this week, the Carver Center is no longer going to be operational
Right,
every
it's gonna be
single.
over a few
Exactly.
people.
And so it's hard to really judge an average number because there's been temperature issues, weather issues, but overall what we are seeing is that between East Bluff and the health department, especially East Bluff, I would say, they're really over 150 daily at that site.
Is that enough for you and your staff to begin to draw some type of maybe some assumptions on what this data means? Are you guys starting to get enough tests where you can sort of judge where things are?
So the question is, with expanded testing from Heartland, are we able to kind of get a better understanding of where we sit? And I would say, I think even the governor spoke about that today. As time goes by, our models get stronger and our predictive abilities get stronger. And so with that, I think right now Heartland, in all the testing that they've done, they've had 73, which is about 3% positivity just at the Heartland Health Service sites. And so I think it does give us a general better understanding, but again, noting the fact that a test tells you your status at that given time point. And so with more testing, we, again, hope to get not only an understanding of how much the disease has kind of gone through our community, but where we sit at any given point. I think regionally for the North Central region, according to the Restore Illinois plan, I think that we currently sit at 9% positivity. So again, for 27 counties at 9%, here just locally with Heartland Health Services at 3%, I think we can make a safe assumption that we are relatively low in terms of positivity rates. But again, we still highly recommend people to get tested, utilize those services. If you have symptoms, continue to get that. Because again, knowing your status, being able to then to take yourself out of play, so to speak, and isolate and quarantine is going to be the best way that we can control transmission.
But if you just said that the tests are only a moment in time, as you said, and you're encouraging as many folks to get tested as they can because it can help you get data points. What data? I mean, what are you trying to find out? And let me ask, because you just, when I asked earlier, what are we able to draw any type of assumption? You said we aren't there yet. We need more, and we want, but the tests are just a moment in time. And then you're telling people to go and get more tests. and to keep on doing it, what exactly are you trying to find out?
So I think the important thing to, especially in this role of public health response, is we never want to make assumptions. Because I think when we make assumptions, it never really leads to anything good. What we are asking for individuals to is to get tested, especially since, and Sharon Adams mentioned it last week too, 47%, I believe is what she said, were individuals that were asymptomatic, 42% had no symptoms at all. Thank you for that clarification. 42% had no symptoms at all, and found out from their testing that they were positive. So again, it just shows you the importance of having testing and increased capacity in our community. And so again, take advantage of our test sites. They are available. If you feel that you have symptoms, definitely attend those. And again, they are now in Peoria at 2 locations as well as in Pekin. So we want to make sure we get a large ability for people from diverse areas and locations to access them.
Could people, and this is the last thing, could people who got tested, let's say, last week or two weeks back, come back and get tested for a second time? And I ask that because, again, it's a moment in time. They were fine then, but they might not be fine now. The vice president had one of his aides get checked 6 or 7 times, and finally one came up as a positive test. Are you going to encourage people to go back often, or once you get it, you should let others go?
I would encourage individuals that if they've gotten tested and received a negative test results, and during a time frame, if they feel that their exposure has changed or if they have any other issues, in dialogue with their healthcare provider, I recommend getting tested again.
One last question. I'm sorry if you already said this, but of all those that have tested positive, how many people were asymptomatic?
So we only know from the Heartland Health Services. Of the Heartland Health Services, those that tested positive, 42% were asymptomatic. Okay. Thank you.